And then we will welcome our second speaker, Dr. Gaszynski. He's the head of Department of Anesthesiology and Intensive Therapy from Medical University of Lodz, Poland. He's also the president of Polish Society of Airway Management. He has been doing clinical trials regarding our video laryngoscopes and laryngeal masks, so he will be sharing his relevant clinical experience. Let's welcome. Hello.
Hello.
Hi. Yeah, you are good.
Hi, can you hear me? Can you see?
Yeah, we can hear you.
Okay, that's a great pleasure for me to be here. And thank you very much for your invitation. Now I will show you my experience, clinical experience with products.
Yes, please.
Right, so the wonder world of UE products, of airway management, my clinical experience with those products. Alice in Wonderland of airway management devices. This is how I feel sometimes. I'm an airway enthusiast. And I must say that when I look at the products of UE Medical Corporation, I sometimes feel like this Alice in Wonderland. This is a picture of my daughter taken a few years ago. As you can see, she was playing with one of the airway devices, and I completely understand her. I really like new devices. I really like trying them, and I really like to introduce them in the clinical practice. So let's follow the white rabbit. Points to discuss. Consideration in choosing UE products for center surgeries, the benefits that I observed, and some comments on UE products comparing with similar products I've experienced. You know that video laryngoscopes and video devices for airway management can be divided in several parts. And we have, for example, Airway, laryngeal mask with integrated monitor. We have video stylets and video laryngoscopes with blades that are similar to standard Macintosh-like blades or especially angle blades. And when you look at the products of UE Medical Corporation, almost practically all of those categories are filled with those products. We have very nice video laryngeal mask Airway with a camera that allows you to see the entrance larynx and to follow possible intubation. We have a video stylet. We have also the wide range of video laryngoscopes with different blades and different monitors. So let's start with my experience with patients in ENT surgery and maxillofacial surgery. Those patients very often have limited mouth opening or some tumors in the pharynx, mouth, and larynx. And of course, this is the predictor of possible difficult intubation. The golden standard for these patients is flexible video scope or fibroscope. And of course, UE Corporation has this device. But from my experience, I must say that very good alternative to fibroscopes are the video laryngoscopes and video stylets. If it allows to introduce a blade, I mean the limited mouth opening, more than about 1.5 centimeter, you can try to do intubation, airway management with video laryngoscope. And from my experience, it's a very good idea, especially for operators that are not very skilled in fiber optic intubation. So this is what I confirm from my experience with the UE products for this kind of patients. It's absolutely easy to use, reliable, very good quality of picture, and possible recording of pictures and videos, which is not common feature of all video laryngoscopes available in the market. Some very popular video laryngoscopes, big companies, when you look at them carefully, you can see that there is no possibility of recording pictures and videos. You can ask why it's so good idea, not only for teaching purposes, but also for legal purposes. In my country, I suppose the same in all of the world, more and more patients sue doctors for some possible mistakes. And if you are able to record some video with your action, this is what you did, it's your protection. This is one. And second, very important, we tend to change medical history of patients to electronic medical history. So if you can attach the picture of, for example, entrance to larynx and save it and give the patient this record, this is very useful for future operations, for future anesthesia. So this is one of my patients that I managed with the UED video laryngoscope. As you can see, the patient is after trauma, a face trauma. He lost his eye and he has a very limited mouth opening because of the problems with mandible and jaw. And this patient has trismus that he has about 1.5 centimeter opening of the mouth, which is absolutely enough to introduce the blade of UED video laryngoscope. On the right side, you can see the comparison of diameter of blade of UED video laryngoscope and Macintosh like blade from McGrath Mag. You can see on your eyes that this is a difference in diameter. So comparing to this video laryngoscope, UED video laryngoscope requires less space, less mouth opening to introduce and to perform possible intubation and video laryngoscopy. And now let me show you the movie from one of my cases. And this is the patient with the tumor in the larynx, and he's scheduled for awake intubation technique. So under local anesthesia, he will be intubated with UED video laryngoscope. Let's not concentrate on the procedure because it's not the topic of our meeting, how to anesthetize the patient for local for awake technique. I just want to say that not every video laryngoscope is good for this kind of technique. Generally, it's important to have this kind of device that allows you to introduce the blade very smoothly with no disturbing the pharynx of the patient. Of course, although it's anesthetized locally, still the patient may react if you introduce a quite big blade of video laryngoscope. So, as you can see on this video, the introduction of UED video laryngoscope under local anesthesia, the patient is conscious, is breathing. This is the idea of awake intubation in possible difficult intubation. Produced practically no reaction from the patient to this stimulus. The only reaction it's very common is when you introduce the tube, pass through the vocal cords. But after you pass the vocal cords, the patient stops coughing and you can ventilate the patient. You can see he's conscious and he's breathing now through the tube in the endotracheal, in the trachea. Another group of patients that I'm dealing with in my hospital is bariatric surgery. I work in a busy bariatric center. We have a lot of operations, and not only obese patients, morbidly obese patients for bariatric surgery is our concern, but also we have more and more obese patients for other operations. So generally our experience with morbidly obese patients in bariatric surgery can be also transferred to other patients. And video laryngoscopes are recommended in such patients. I use as a standard video laryngoscopes for the operation, for the intubation in bariatric patients. The benefits that I observe is absolutely less traumatic than Macintosh-like blades, faster and more successful intubation compared to standard laryngoscopes. So let me show you now the video, a short video from intubation of my patient, morbidly obese patient, 130 kilograms, using UED video laryngoscope. As you can see, very, very good visualization, very nice quality of the picture observed, and fast atraumatic intubation available. Another interesting and very good product from UE medical company is video laryngeal mask Airway. I found it very useful for bariatric patients because it allows for fast airway management and oxygenation. As you all know that obese patients, morbidly obese patients, are very sensitive to fast desaturation. So if we have the situation that the patient deteriorates very fast and desaturates, we must not wait until the saturation drops dramatically. And we have to introduce the methods of oxygenation. And one of the methods is introducing laryngeal mask Airway, and then intubation through its lumen using fibroscope. But this device that you can see on the picture on this slide, video laryngeal mask, is very novel and very interesting device for me because you can intubate under vision control without fibroscope. So let me show you a movie from one of my patients, a lady, 160 kilograms. You can see she has all the predictors of possible difficult intubation and possible face mask ventilation, difficult face mask ventilation. As you can see, the introduction of a video laryngeal mask was very smooth and very fast and effective. I can confirm that in the morbidly obese patients, supraglottic airway devices work very nice. And you can see on the monitor that we have carbon dioxide. So the ventilation is achieved. And of course, the oxygenation of this patient is achieved. And now we can approach to intubation. Supraglottic devices, airway devices, are recommended for temporary ventilation in morbidly obese patients. So it's for rescue in failed intubation, for example, or some rescue action, or for temporary oxygenation before the intubation. It's recommended, especially in longer operations, in morbidly obese patients, super obese patients, to intubate those patients, not to continue anesthesia on supraglottic airway devices. That's why we decide to intubate this lady. Also, it's important to know that this would be laparoscopy cholecystectomy. So the insufflation of peritoneum, creating pneumoperitoneum, can also lead to increase pressure in airway and decrease of possible ventilation in such patients. As you can see, we have very good view of the entrance larynx. We can adjust the mask, and now the tube is introduced through its lumen without fibroscope, just looking at the monitor of video laryngeal mask. And fast, atraumatic, successful intubation was achieved. Another interesting experience that I had with UE products is in neurosurgery and trauma patients with cervical spine injury. A video laryngoscopes should be used in these patients. And the benefits that can be observed when you use video laryngoscopes in these patients is less traumatic and no need to remove cervical collar. Of course, all we know that in guidelines, in manuals, if the patient has a cervical collar because of cervical spine injury, when we want to intubate this patient, we can take off the collar and apply manual inline stabilization. But if we don't have to remove cervical collar, it's definitely better and more positive for the patient outcome. So let me show you the movie from another patient with cervical collar. As you can see, the cervical collar is not removed for intubation. Very good view observed. And the intubation can be performed, as I said, without removing cervical collar from the patient neck, which for sure is better for the patient outcome. Another interesting case that I had is patient with limited possibility of positioning, like a patient with spondyloarthrosis. And video laryngoscopes can be used in these patients instead of fibroscopes. Why, you can ask? Because it's easier to use. And when you have the video laryngoscope that has wide range of movement of monitor, it allows for so-called front intubation technique, which is not common feature of every video laryngoscope on the market. This video will show you what I mean. Wide range of movement of the monitor. So you can introduce the video laryngoscope standing face to face to the patient, which, as I said, in some patients like this with the spondyloarthrosis problems is very, very good technique. So I mentioned about laparoscopy and that this patient, morbidly obese patient that I showed you a minute ago, was scheduled for laparoscopy cholecystectomy. And we decide, of course, to intubate him because it's recommendation in such morbidly and super obese patients, the supraglottic devices, airway devices should be used for temporary ventilation. But in non-obese patients, we can do laparoscopy on supraglottic airway device. You know it, I know it, we do it. And again, video laryngeal mask airway can be used as a very interesting device for such procedures. Of course, the benefits that can be observed during the use of laryngeal mask for laparoscopy is less traumatic than endotracheal intubation. But when you use video laryngeal mask, you have continuous control of airway and possible intubation if it's necessary without removing laryngeal mask and without need for fibroscope. Only few laryngeal mask supraglottic devices on market have this feature of continuous control airway visualization. So the mask is introduced classically. It's important to mention that video laryngeal mask airway of UE company, medical company, is a third generation supraglottic airway device. So it has improved seal and higher pressure can be used for ventilation of those patients with the good seal with the airway. And another interesting feature that is very useful is continuous observation of position of the laryngeal mask in the airway of the patient. You can adjust this position, and especially when you inflate pneumoperitoneum, when you create pneumoperitoneum, it may happen that the laryngeal mask or any other supraglottic airway device can be a little bit dislocated. So if you have the possibility to control the right positioning of the supraglottic airway device during whole procedure, is absolutely advantage and for the safety of the patient. And as I mentioned, the video laryngeal mask airway, this categorized as a third generation of supraglottic airway device. And another interesting case that I would like to show you, the rapid sequence induction for urgent operations in anesthesia. Rapid sequence induction is some procedure that requires good skills and good equipment from the operator, because you have to intubate very fast because the patient may regurgitate during this procedure. And video laryngoscopes can be used in these conditions for better visualization of entrance of larynx. And what is very important, in my opinion, fast recognition and possible management of possible complications like esophageal intubation and regurgitation. This happens really not very rarely, as you know from your clinical practice. Today, I had a patient for rapid sequence induction, and a resident that I supervised intubated the patient to the esophagus. And because he used Macintosh-like laryngoscope, standard laryngoscope, I couldn't help him. I couldn't see and couldn't tell what to do not to intubate into esophagus. So using video laryngoscopes in such conditions has more benefits, not only better visualization, not only fast recognition and possible management of complications, but also someone supervising or just colleague can give some advice to operator how to deal with some problems. So let me show you another movie of my patient for rapid sequence induction. As you can see, we apply Silic maneuver, although it's now more and more papers show that it's not very useful, but in our procedure, we still have Silic maneuver for these patients. And in this case, we use also UED video laryngoscope. And as you can see, it's very important that you see the entrance larynx, and other colleagues also can see and can tell you what to do, how to adjust and do the successful intubation. So, on summary, UE Medical has a wide range of airway products that fulfill all aspects of modern airway management techniques in different airway scenarios. They are especially useful in difficult airway, but can be used in standard practice to reduce possible complications. Video laryngeal mask is third generation supraglottic airway device that can be used in a wide range of surgeries, including laparoscopic procedures. I performed several video laryngeal mask anesthesia with a laparoscopy cholecystectomy, and I confirm that good seal pressure was maintained, good ventilation, and I could adjust the position of the laryngeal mask regarding to the stages of operation. And UE video laryngoscopes have good quality of picture, a wide range of monitor movement, which is also in some cases very good an advantage, and possibility to record pictures and videos with a wide range of blades and different blades. Thank you very much for your attention. Thank you very much for joining this journey through the wonder world of UE airway management products. And thank you very much.
Thank you, doctor. Anyone got any questions for him or would like to share any kind of relevant experience? You're welcome to talk. Anybody?
Hello.
Hi.
My name is Nisar, King Faisal Hospital, Saudi Arabia. I'm an anesthesiologist. My question is to Professor Gaszynski. Would you use this video laryngeal mask in case of failed difficult airway in obstetric practice, please?
You mean difficult airway in what patients?
In obstetrics, in maternity,
In
cesarean
obstetric. Yes. This is very interesting topic. Thank you very much for this question. What can I say? The golden standard is endotracheal intubation. And that should be done. But you all know as practitioners, and you especially as a practitioner, you know that sometimes for cesarean section, we have very limited time to deal with this. And then we have difficult intubation in pregnant women. For cesarean section, for example, we have to introduce laryngeal mask immediately and continue anesthesia. So if we are able to visualize vocal cords using video laryngeal mask, in this case, I would say it increases safety of this patient. So I suggest to have this device also available in obstetric departments. Thank you very much for this question.
Thank you.
Anyone else?
Yes, I would like to ask a question.
Yeah, please.
My name is Andre van Zundert. I'm greetings from Brisbane, Australia. I have a question for Thomas. Thomas, we always want to know whether if there are failures of airway management, whether you can use the UE scope when other classic laryngoscope fails or when other video laryngoscope fails.
Okay, so what can I say? Especially talking about UE products. First of all, I'm very glad with the quality of picture that is achieved with these devices. So when you compare the other video laryngoscopes available on the market, they have very different quality of picture. Just to give you the example, a few years ago, I did a study on technical properties of different devices, airway devices, and together with technical university in my city, and we evaluated the area of covered the view, quality, light, etc. And believe me, it differs very much. So if I have a device that has very good quality of achieved picture, for sure it's safer for the patient. It may happen, I think it may happen that UE products will perform better in some patients than other video laryngoscopes. And the second, this is what I already mentioned. If we have, for example, failed intubation in patients, unexpected difficult intubation, for example, we can use video laryngeal mask to, first of all, to oxygenate the patient, to increase safety, and then to think what to do next. And what can I say? Not every anesthesiologist is very skilled in fiber optic intubation. So if we have a device that works easier, it's definitely better for clinical practice.
Thank you, Thomas. I
Thank you.
I completely agree with you, and I really think there's an opportunity for anesthesiologists to be practicing in in the use of video laryngoscopes. Not too many are really well educated in using video laryngoscopes, and it's different from a classic laryngoscope. Absolutely. So thank you very much for your lecture. Well appreciated.
Thank you.
Thank you. Yeah, the next question, please.
Yes, I have a question. Thank you for the valuable presentation. It was really a good experience for us about this one. My name is Musa. My background is anesthesia. I'm a distributor of laryngoscope Saudi Arabia. I would like just to ask you, Doctor, about regarding to make the video laryngoscope standard of care. So instead of direct laryngoscopy, to use video laryngoscopy. We would like to share your experience about that, because here in our country there are hospitals totally transferred to video laryngoscope. Totally, in all cases, they apply the video laryngoscope, not direct laryngoscope. Thank you.
Okay, thank you very much for this question. I can say from my personal experience that we should not forget about standard laryngoscope. Teaching is very important, and for example, I start teaching residents with video laryngoscopes because I can see what they are doing. I can tell them some advice how to introduce the tube, for example, or adjust the blade. But after 1 or 2 years of training on video laryngoscope, we train them also in standard laryngoscope. You may ask why? What for? Because, for example, everyone now is driving very nice cars with automatic gear, etc. So why we should go back to some old-fashioned things? The answer is very simple. Every electronic device can break, and it happens in my clinical practice that suddenly we had problems with light or monitor, and the patient desaturates, and we have to do something. Of course, we can introduce laryngeal mask, oxygenate, and ask for another video laryngoscope, but sometimes there is no time to do it. So it's very important to be skilled in also standard laryngoscope. And very interesting, what I should say, if you have video laryngoscope with the Macintosh-like blade, you can use video laryngoscope even if the monitor fails as a standard laryngoscope. So it's, in my opinion, it's good to teach our colleagues, young colleagues, to standard laryngoscopes. And of course, as Andre mentioned before, the technique of using video laryngoscopes is completely different. So it should be simultaneously, or as I have the experience, we start with the video laryngoscope, but then we introduce the standard laryngoscope teaching. Thank you very much for this question. It's a very, very important topic.
Thank you.
Thank you.
Yeah, the next one. Yeah, Mr. Chen, you're good to go.
Hello. Yes, can you hear me?
Yeah, we can hear you.
Oh, thank you for that explanation. I agree with you, Thomas, for the teaching. My question is that using UE products, do you find that, I mean, for us who are experienced in airway management, we know how to adjust ourselves. Do you find that UE products are better used with residents? Would you feel that they are better comfortable in opening the mouth and using the products, or is this mainly for very difficult intubations that want to take pictures of the larynx and be careful with the patient? Or do you think that this product is excellent even in the hands of the residents?
Thank you very much for this question. I must admit that some of the videos that I showed you were taken when the residents used these devices. I was the cameraman. So that maybe answer your question. I absolutely confirm that UE products, video laryngoscopes, are very useful in hands also of residents, not very experienced people. So just to confirm, I really say some of those movies were taken when the residents used UE products, as you could see, successfully.
That's good. Thank you.
Thank you all. Thank you for your good questions, and thank you for Doctor's insights. So personally, I'm very happy to be part of this brilliant conversation, to listen to your conversation. And thank you, Doctor, again. So thank you, Doctor. We really appreciate your trust and support. Since we have been embracing the idea of improving products based on feedbacks, we cherish every chance for clinical trials and hope we identify more product improvement opportunities from future collaborations.